above this edge of the gray, everybody would be apneic. Nobody would be breathing. And what it shows is that even with this small dose, some small fraction of patients, I could calculate it, but some small fraction of patients is at risk of apnea, even from this dose, in the presence of just propofol.
And that's demonstrated where in the model?
Right here. It says that from about 1 minute to about 2.5 minutes, the level in the brain is high enough from this small dose that a small fraction of patients would be expected to very transiently stop breathing. Because after, say, 3 minutes, the levels in the brain have gone down again. So after 3 minutes, you'd expect everybody to be breathing again.
And in this model, as well as the ones we'll be talking about shortly, you always use the femoral blood of 2.6,
Correct.
Being the actual propofol drug concentration.
Correct.
And is that actually the more conservative number to use?
Correct. There were 3 levels measured. 4.1 in the hospital sample, 3.2 from the heart, and 2.6 in the level measured on autopsy. So this is the most conservative of the numbers that were measured and reported by the coroner.
So again, then, even with a small dose of 25 milligrams, there would be, for a brief period of time, a period where there's risk of apnea.
Correct.
And if a patient had had other drugs, for example, other benzodiazepines, would that increase this apnea risk as depicted in your model?
Absolutely.
And that's because of the effect they would have on breathing as well?
Yes.
Now, this particular model depicting the 25 milligrams and the risk of apnea, knowing that Michael Jackson did receive lorazepam, midazolam, diazepam, as well as lidocaine, would this have affected Michael Jackson in this case in regard to the risk of apnea?
Absolutely. All of these drugs have the potential to cause a decreased drive to breathe. And you add propofol on top of it, on top of these other drugs, then, again, it only increases the risk of apnea beyond what is already a modest but very real risk.
And going back to your testimony earlier regarding the standard of care, you indicated that even with just 25 milligrams of propofol, the safety precautions and the standard of care that you testified about was required, correct?
Yes.
And is that, as it relates to this model, how is that related?
This is actually the mental picture that I have when I tell people there's no such thing as a small dose of anesthesia. That even with this dose, there is some risk.
Now, in this first scenario regarding propofol then, assuming just 25 milligrams of propofol was administered, in your expert opinion, is this what happened to Michael Jackson?
No.
Why?
If you look at the concentration here, if he had gone apneic at 2 minutes, he would continue to have circulation at least out here at 10 minutes because the heart just doesn't stop. When you no longer are breathing, there's oxygen in your lungs, and he was on extra oxygen anyway. So he has a period of at least 10 minutes. So going from 2 minutes here really I'm just going out 8 minutes, but look how low the levels are. They're vanishingly small. This is what was measured by the coroner, and the actual levels at 10 minutes were vanishingly small. So this didn't happen.
And Michael Jackson then must have received more than 25 milligrams.
Yes, Michael Jackson received more than 25 milligrams.
Going to the next simulation. Now, this one, assuming a 50 milligram IV administration of Propofol, what does this model represent as to the administration of Propofol? Are you assuming it's diluted? Can you just please explain?
Yeah. The way that Conrad Murray, in his interview, described giving Propofol was taking a syringe and filling it with Propofol and lidocaine, and the description was that he used about equal mixtures. I think the word one-to-one showed up in the interview, one-to-one mixtures. So a 10 cc syringe would have 5 cc's of Propofol, which would be 50 milligrams. So this is looking at the administration of a full syringe, half 10 cc syringe, half Propofol, half lidocaine, but I'm only going to look at the Propofol shown here.
So this, again, just to be clear, this model represents an injection of 50 milligrams of Propofol with the assumption, based on Conrad Murray's interview, that it's mixed with another 50 milligrams of lidocaine.
That assumption is how I came up with the 50, but the lidocaine was not incorporated into the model. The model was just for the Propofol.
For the amount of Propofol.
Yes.
And if Michael Jackson had been given 50 milligrams of Propofol, half a syringe, is that what is represented in this model?
Yes, half a syringe given as what's called a bolus. Remember we talked infusion and bolus. Bolus is you push it all in once. Half a syringe pushed in all at once. Pardon? Or a whole syringe of half Propofol, but pushed in all at once would give you a very high level here. It's about 12 actually.
And you're actually pointing above the chart.
That's correct, because it's actually up here where this dotted red curve for the blood starts. It starts up here somewhere. And then it comes down very quickly. The brain levels, the effect site level rises quickly. And by this point in time here, you actually would expect most patients with this dose to not be breathing. And then it comes down here. And within about 5-6 minutes, the level gets low enough where you would expect patients to, again, be breathing.
And in this model then, with this dose rather, of 50 milligrams, specific to Michael Jackson with the knowledge these other drugs are on board, would he have stopped breathing if he received this dose of 50 milligrams?
Yes, I think it's quite likely he would have stopped breathing with this dose because there were so many other drugs that he had already received from Dr. Murray.
And can you say with certainty when he would have stopped breathing?
I can put boundaries on it.
And what are those boundaries?
I would expect him to stop breathing somewhere between about 1 minute and 3 or 4 minutes after the dose. It would be pretty early following that dose because then after that the levels are dropping. Yes.
And would that period of apnea be sufficient to cause, for example, permanent brain injury?
Depends on when he starts breathing again. If he stopped breathing here at 2 minutes, let's say at the peak, and started breathing here at about 5 minutes, then that's just 3 minutes of apnea. He's on extra oxygen. Since he's on extra oxygen, he has more oxygen in his lungs. I would not expect there to be any brain injury.
And in this scenario, Michael Jackson receiving 50 milligrams of Propofol, and you indicated earlier, then once he hit apnea, the heart would beat for approximately 10 more minutes?
At an absolute minimum, the heart would continue beating for 10 minutes.
And according to this scenario, then, of being given 50 milligrams of Propofol, does this give you the femoral vein concentrations found at autopsy reflecting a time of death around noon?
No. Once again, Propofol's metabolism is so fast that provided the heart is beating and there's still circulation, Propofol is being metabolized. So what you would expect to see on the autopsy would be a level down here. But that's, and then by the way, keep in mind, it's the red line, it's the dotted red line. So you'd expect to see something here at the level of the dotted red line on autopsy, which is just a fraction of what the coroner measured.
And based on your modeling supported by the data in this case, then does that rule out administration of a single dose of 50 milligrams of propofol?
Yes, it does.
Now, what if an entire syringe, not diluted with lidocaine, so an entire syringe containing 10 cc's or 100 milligrams of propofol was administered? Did you conduct the simulation assuming those facts?
Yes, I did.
Then going to the next slide, is that the slide represented here entitled Propofol 100 milligrams?
Yes, it is.
And can you describe your findings as it relates to this scenario?
Yes. The propofol levels in the brain rise, reach a peak here, again at the same time. The time of peak doesn't change. It's about 1.5 to 2 minutes at about 6, and then quickly come down. And the patient will be apneic. This is what I do every day, or even more drug than this. It's the induction of anesthesia. So this is an anesthetic induction dose. Actually, it's a little small, this anesthetic induction dose. And so I do this every day. And everybody stops breathing. And I take over and I breathe for them, because that's how you start anesthesia. So this is an anesthetic dose.
And in this scenario, when would Michael Jackson have stopped breathing?
Within a minute.
And then when would his heart have stopped?
Minimum 10 minutes later. So the heart would have stopped here at the earliest. That's an absolute minimum.
And where then is the blood level, assuming an administration of 100 milligrams, where is the blood level at 10 minutes?
The blood level is the dotted line again. So the blood level is here at about 0.5, maybe 0.6. And the femoral vein concentration here of 2.6 is well above the blood level, which is just down here at 0.5, 0.6.
Does that rule out then that Michael Jackson received a single full syringe of 100 milligrams of propofol?
Yes, it does.
And again, because the femoral blood levels are just simply too high?
Yes.
Did you analyze the facts of this case with the assumption that maybe multiple syringe injections were administered?
Yes, I did.
And going to this slide entitled Self-Injections, 6 injections, 50 milligrams each. First of all, how would one self-inject propofol?
Self-injecting propofol would involve first drawing up the propofol in the syringe. As you saw yesterday, that's actually not that easy to do. You would then find the injection port on the tubing, and you would have to then attach the needle through the injection port and push it in. This is something which takes a little bit of time and a little bit of coordination to do.
And what about not using a syringe? In other words, using a syringe or an IV line? Or let me just ask you the two scenarios. Once you were able to retrieve the drug from the vial, there are two possibilities, right?
I'm sorry, I didn't understand the question. Yes, there are two possibilities. If you had good veins, you could just